I'm Alex G, and I'm a black man, and I'm angry. My anger is justifiable, and I want you, my non-black allies, to be angry with me. Suppose a worldwide pandemic broke out. Say it's called COVID-19. It hits your home state that's known for disparities against African American people anyway. Suppose you find out that to date, there are 2,900 confirmed cases of COVID-19, and that there are 114 deaths in the state of Wisconsin. Suppose then that you find out that 27% of those confirmed cases are black, but 49%, half of the deaths are black. In a state where black people make up 6%. And suppose, just for a moment, suppose that not a single black person you know is surprised. A state that is known for so many disparities among its black people has caused such microaggressions and stress. Those things have become social determinants of our health. And we knew pre-COVID-19 that we were predisposed to heart attack, stroke, cancer, dementia. And then COVID-19 strikes. And 49% of the victims who died to this ugly pandemic look like me. And people have been wondering why we're angry, why I'm angry. I just need to vent a little bit, and I hope that you just dare to stay with me for just a moment. What's floating around now is that these African American people don't have access to good health care, or maybe they're afraid of doctors, or they don't have a primary physician, so they use the ER as their primary clinic. And we have to find a way to help these underprivileged, disenfranchised black people get good health care, because that's why they're dying. It couldn't have anything to do with our healthcare system, could it? It couldn't have anything to do with the lack of representation in the medical fields now, could it? Excuse my sarcasm, but I think certain current circumstances would justify my frustration and my anger. So I'm in the process of finding a new physician. I'm a 56-year-old black male, and I have hypertension. I've known since I was 40 that I should have a prostate exam. I know, too much information. I go into my new physician. It's my annual physical. I explain, these are my concerns, these are things I need you to watch, and oh, by the way, it's been a year since my prostate exam. He tells me that he's not going to give me one. Well, I had just attended a 100 Black Men walk fundraiser event that was giving information to us as black men how we need to take care of ourselves in light of sorry, I'm losing my train of thought. In light of prostate cancer, because of how our numbers are rising. And they said, demand a blood test and the physical part of the exam. My doctor started telling me why I shouldn't do it, that over 90% of men will die with it, not from it, but with it. He started running down all the things that if you find out you do have it, you'll want to have an operation. I said, like most people do when they find out they have cancer? I said, yes, but some of those are extreme. You may not need them, and it might just affect your sex life and your normal life, and we just prefer you not do it. Yeah, I looked at him just like this. And then he said to me, so do you still want to do the exam? And I said, yes, I want to do the exam, like I told you 10 minutes ago. So I got in my car after the exam. He begrudgingly did it. But as I drove home, I thought, in addition to worrying about the nursing home facility for my mom, the experiences my daughter's having on UW-Madison's campus, navigating this world as an educated, middle-class black man, I now cannot trust my physician to look out for my health This isn't being pissed because someone wouldn't put money in my hand when we're transacting a sale. This is not being frustrated because someone thought my white assistant, who's young enough to be my son, you must be Dr. G. No, actually, my boss is. This isn't just being overlooked. I now have a physician who's trying to talk me out of exam procedures that could have a bearing on my life. I have a wife, I have a child, I have organizations that I'm trying to do. I have people who are counting on me. I have employees. And now, in addition to everything else that I must do as a black man, I now no longer trust my physician, who does not think that it is prudent for a black man to have an annual prostate exam. Do I need to list how many black men I know who are just a few years older than me, who have prostate cancer because they did not get the exam or didn't do it regularly? And I'm trying to figure out where the hidden cameras are. This has got to be some game. This has got to be a hidden camera. So I drove home thinking, in addition to everything else that I navigate as a black man in this world, in this country, in this state, in this city, I now have to wonder if the person who writes my prescriptions, takes my temperature, orders my blood panels, really understands what it means to be black in this world and to be healthy. And by the way, hell yeah, my blood pressure shot way up when I left the office that day. Let's just be clear. COVID-19 is not taking the lives of black people because we are ignorant, uninsured, and afraid of doctors. My story is just one. I wish I had enough time in this video to bring the black men and black women, and I'm sure other people of color, into this video to tell you what their doctors and what their nurses have said to them about what they need and what they don't need. We just got work to do. And the issues that we're needing to address in our community will not only make black people prone for COVID-19, but the next illness, the next sickness. Let's hope to God there's no next pandemic in our lifetime. And then now that we know that this is happening, it has raised the stress level. I'm sure the blood sugar levels of so many black people who are just trying to obtain the American dream. So for those of you who are out there who are reading these reports and are just thinking, these poor black people who don't have insurance. And can I just keep venting for just a moment? What I really want to know is, of those 49% who have died, who are black, did they have access to ventilators? Because as you're reading some of the information about how decisions are made, you often hear, just across the country, that there's so many factors to consider pre-existing issues. You mean the pre-existing issues like stress that comes from trying to navigate work and your realtor and your mother's nursing home and your child's educational process and your wife's stress at work, and you're just trying to have a healthy physical that can allow you to live, 30 or 40 more years. So the stress that exacerbates the health issues that then leads to health disparities among black people can now be considered the thing that can prohibit them, us, me, from getting a ventilator during this pandemic. We got work to do because we've got to address COVID-19. But the issues that have been present for decades, centuries, that we've been talking about, that people don't want to hear us talk about, that we've been trying to bring our white allies into the knowledge of and non-black allies into the knowledge of, these underlying things are just causing us to be sitting ducks for COVID-19. And in some states, it's affecting those who are making ventilator assignments to look at us differently. It shouldn't cost this much to be black in this state. It shouldn't be this hard to just be a part of this community. So I just want to say that because I want you, our friends, our partners, our allies, our would-be allies, just to begin to look at some of these things in news headlines with a different lens. And I wanted to tell you my story with my physician, and I just secured a new one this week. This in the midst of the pandemic. Yes, shifted in the middle. Yes. Do you think I want to go tell that man that I have symptoms? Do you think I trust him? Do you think he trusts me that I think he trusts me? Do you think it's fair that I've never seen a physician who looks like me? I've laid eyes on them, but I've never been seen by a physician who looks like me. That I've got to code switch and watch closely and argue my point and to watch for cultural insensitivity just to stay healthy? I just want you to know that this lie that's out there, that this is killing so many black people because we are poor and uninsured and unhealthy, I want you to know that that's not necessarily who's dying. That's certainly not all of who's at risk. And that's not necessarily true for every person. In the midst of these very difficult and very frightening times, I do see a kinder, gentler humanity emerging. In the midst of watching polling places reduced to 5 or 6 places in Milwaukee. Come on, we're reading the headlines. You do know that people got infected while voting. You do know this, right? And you do know that black people know it, that we think about it. You do know this, don't you? Because being allies, being non-black allies, is not convincing us to think like you. It's up to you to understand how we think and how we see things. Because it's not the first time, and this is not our first rodeo. But it's probably the nastiest and the most blatant rodeo we've had probably since right before the Civil War. And you know what I mean. But in the midst of this, community activists and leaders and organizations, churches that are helping to distribute food, and United Way and Boys and Girls Club and Selfish Ambition and Madison 365 and Anesis and Nehemiah and others are doing tremendous work. Mount Zion Church, others are doing tremendous work in our community to try to help the most vulnerable among us. I'm just saying all that I'm saying to let you know that once we have addressed COVID, we have to still do the work of addressing what has caused COVID to kill so many black people in a state that already has too few black people. Look, y'all, I don't want to die, and not like this. And so we've got to continue to work together to get the message out that there are some very real social determinants of health that's impacting people of color. And we have to keep working together. Let's not look the other way. Let's not just pretend this is an issue of poverty alone. Let's look at the facts. Keep your eyes open. Keep your ears open. Because if we've never had a wake-up call in Madison, Dane County, Milwaukee, the state of Wisconsin, I don't know what will be. In the midst of these times, I want you to take a look at this video of staff members who are out shopping, making sure that men in our reentry housing, that they're still getting food. Unemployment's hitting folks hard because you can't bag groceries or wash dishes or do the things that many of our clients and participants do for a living. And so because we've been given such a gracious grant, because of the Boys and Girls Club and United Way, we're able to get food and services and support and encouragement and a helping hand to folks in this community. In the midst of the rant, I always try to find the silver lining. You don't have to tell me to do that. I do that for my own sanity. I don't do that because I want to be nice. I do that because I want to be healthy. So I need you to do 2 things. Look at the ugly reality, but also find some bright light. Find some ray of hope. Think about this photo of where people are trying to look out beyond themselves, putting themselves at risk for the sake of someone who's more vulnerable. If we don't see the need to take care of the most vulnerable and disenfranchised among us now, then I'm really afraid. Because if this doesn't do it, I don't know what will. So please, keep that in mind. We appreciate you. You've proven by opening these emails and reading our letters that you want to continually be educated and brought up to speed. That's what allies do. Allies learn. Allies share information. Allies contribute. Allies defend. So, continue to read, learn, share, give. Because allies are essential in coming out of this very, very dark moment in our world's, our states, and our community's history. Please continue to be safe, continue to be informed, and please, to the best of your ability, be compliant to the protocols that are being suggested for our health. We can get through this if we work together, and we can get through disparity if we work together. So let's just become comfortable working together. Okay? Can we do that? I hope so, because our well-being rests upon it, and my health does, and the health of my community. Thank you so much for listening to this message. I appreciate you and this opportunity.